Dr. Sereda, in your opening comments, you also mentioned that you were there to ensure the safety of supply, the safety of your patients. I'd like to hear more how safe supply has had an impact on your clients and patients.
Question, and thank you for giving me an opportunity there. My patients are the focus of my work, and I'd like to tell a couple of stories if I have time in the moment. I'm going to start with a story about a woman who was diagnosed with palliative AIDS, and she lived on the street. She had no health care. She came into the hospital. Actually, she repeatedly came to the hospital with pain and was turned away over and over and over again because she was labeled a drug seeker. And eventually it was discovered that her pain was actually due to the consequences of HIV and the infections she had related to AIDS. And so she was admitted. And at that time, she was told she was palliative, that nothing could be done to help her. And she was discharged to the street, back to homelessness with a palliative AIDS diagnosis and no medications and no support. So it was at this point that our team had a chance to intervene, and we brought her into care, and we prescribed her safe supply, and her fentanyl use completely stopped. And she is now housed. Her AIDS is no longer AIDS. It is well-treated HIV with a controlled viral load. Like I said, she is housed. She is now volunteering in harm reduction programming. And really what she needed was that support to move away from the toxic supply so that she could focus on health issues as well. And she makes really great cupcakes. Do I have time to tell you another story? Okay. Another woman I want to tell you about was also palliative. And this woman, she was deemed to be palliative because of endocarditis, which is a severe heart infection. And so she was in the hospital and she needed surgery and she needed to receive 2 new heart valves in order to survive. And at that time, the surgery team did not feel she was a candidate because she was a drug addict and she had done this to herself and she was going to do it again. And so, again, at this point, our team intervened and there were some
Dr.
strong
Sereda,
advocacy
I'm going to have to interrupt you
discussions.
there. The time is up, but maybe someone on your team will come back to that. Thank you. Monsieur Thériault, vous avez la parole pour 6 minutes.
Mr. Thériault, 6 minutes.
So thank you very much for that opportunity. So again, we intervened with this woman, we advocated, and we put her on safe supply as well, which again extinguished her fentanyl use. She was able to receive her 2 new valves. She was only 21 years old when she told she was going to die from endocarditis. That was more than 4 years ago. She's 25 years old. She no longer uses fentanyl. She is still on prescribed safer supply. She is housed. She also volunteers with us, and she's returned to college, and she really enjoys singing and dancing and knitting in our clinic.